We are live now.
Yes. Hello and welcome everyone to this session for my first year anesthesia residents, to be specific, and also for those of you in second and third year. So we are starting off with the new year, and we want to discuss with you as to how you should navigate through your residency. You must have just joined your colleges, and after the whole first round, second round, third round of allotment, you finally got through into the residency of your choice, and now you need to understand how to navigate your way through it. So whenever we are MBBS doctors, we only think about the fact कि हाँ बस रेसिडेंसी में घुसना है, नीट पीजी में रैंक लाना है, रेसिडेंसी में घुसना है. Okay, so that is the only thing you're focused on, but you don't know what's going to happen in the next 3 years. Trust me, your life is going to change, and I am going to tell you a few do's and don'ts in your first, second, and third year, specifically for anesthesia, but generally you can look at other residencies also. And this is brought to you by the Conceptual Anesthesia app. Just to let you guys know that on the Conceptual Anesthesia app, we have over 400 recorded lectures of all the topics that are related to anesthesia, which are required for preparation of your MD and DNB final year exams. And we also have daily live lectures that are taken by super specialty faculties. And we also help you in preparation for your super specialty, and we have practical videos showing you anesthesia content as well. So moving forward with what are we supposed to do during our residency? First of all, this is live on YouTube. So if anyone has any questions, you guys can write it in the chats and I will address your questions. Now, year one, you are just entering into a professional environment, and that is something that most of you need to understand. Your college life is over, your life of waking up whenever you want, bunking lectures, having breaks that were absolutely up to you. Okay, you want to take a 10 a.m. break, 2 p.m. break, 5 p.m. break, everything is up to you. All that kind of life, sleeping, partying, drinking, going out with friends, that life is now over. Okay. Now the real Gada Mazuri starts. Gada Mazuri in Hindi means donkey work in English. And literally, the minute you enter residency, irrespective of whichever branch you've taken, you're going to be so overwhelmed by the fact that you have to, first of all, have a schedule in life. Okay. What do you mean by schedule? Now let's talk about anesthesia. Most of the OTs, whether you're working in a DNB hospital or you're working in a government medical college, most of the OTs start at somewhere around 8 to 8:30 a.m. in the morning. So as an anesthetist, you're always the second person to go inside the OT. First person is the one who comes to clean the OT. The second person is the anesthetist, and third person is the surgeon. Okay, so you're expected to reach the OT at least 15 to 20 minutes early, and this is something that I see most of the anesthesia residents struggling to do in the first year. Trust me when I say this, that if you're going to come late for OT and your senior has already come in or your consultant has already come in and they have made the drugs and they have checked the machine, don't be surprised if they don't give you intubation. Don't be surprised if they don't give you spinal. Don't be surprised if they give you a cold shoulder, because it sets a very bad example that you are not there in the OT to prepare it, but you are ready to take all the cutting that is related to enhancing your skills in anesthesia. So first and foremost, and I tell you this as a first year resident who has gone late to OT, and I tell you this as a third year resident who has angrily looked at my first year, why have they not come early and prepared the OT? Okay. So whatever you do, like wherever you stay, either in the hostel or you're staying far away, you're a daily traveler, make sure that you reach the OT at least 15 minutes before time. Once you reach the OT 15 minutes before time, a few things that should be ready is your drugs and your anesthesia machine check should be done. You should know where are the basic equipments, like your ambu, laryngoscope, any difficult airway cart, defibrillator if has to be checked. You should be doing all of those things. And if you're doing any special kind of case, like suppose you're doing a pediatric case where your dosages need to be calculated as per the weight of the child. So what I suggest, which really makes an impression, is write down the dosages for that child For example, if you give propofol 2 mg per kg and your child is 10 kg, then you write over there propofol 20 mg to be given to this patient, fentanyl 20 microgram to be given to this patient, something like that, like write in a small chit and stick it on the anesthesia machine. Why stick it on the anesthesia machine? One is to show your consultant that yes, I have done my homework and come. And second thing is to remind yourself also when you're making the drugs. Okay. Now, this is one of the most important things that you need to do in anesthesia, and that is first, always be punctual and come on time. Second thing is, as an anesthesia resident, you will be given ample number of breaks. We are a very chill branch. We believe that everyone should have their breakfast, lunch, evening snack, and dinner on time. So don't worry that you are going to be on an empty stomach. But I would suggest that, as you can see over here, during emergencies, you're running around, as you can see in the picture. So always keep some kind of healthy snacks ready. Now, when I mean healthy snacks, I mean like you can keep some protein bars ready, or you can keep a piece of, like chocolate, because that gives you a little bit of a happiness quotient also. So always keep that ready, because during emergencies, your dinner time may get pushed from 9 p.m. to 11 p.m. and then you'll be on an empty stomach, and that really makes you angry and irritated, and that makes you more argumentative. Okay. So be prepared for this kind of life. Your life has to have a schedule, but you should also be little bit flexible, that sometimes the timings may go up and down. You may be relieved late from OT some days, you may be relieved early, you may have to wait back post call, post emergency also, depending on the case. So be prepared for a life of working hard. Okay, that is the most basic step. Second thing, as I told you, set your routine. So when you set your routine, I mean by the fact that you should have a particular waking up time every day, so that you know, see, Monday to Saturday you're going to be working. Sundays, if you're not on call, you will have off. So you know that you have to reach the OT by 7:45. So make sure that you're not waking up late, you're always on time. And when you're leaving the hospital also, make sure that you are actually having some kind of evening routine. Okay, when I say evening routine, that means residency is tough. So you're very tempted that you'll just go home and while your time away on your phone scrolling Instagram and social media and YouTube and watching Netflix. So you can actually end up wasting all your 3 years just like that. But if you set an evening routine, for example, if you know that every day you're going to be let off from OT by say 5 p.m., so you can set a routine that from 6 to 7, I'm going to do some recreational activity, maybe go to play or listen to music or watch Netflix at that point in time. And I'm going to spend 1 hour reading every day. So 7 p.m. to 8 p.m., I will read. 8 to 9, I will have my dinner and TV time. And then 9 to 10, I'll just relax and then go off to sleep. Okay. So make sure that from the beginning itself in your routine, you are giving 1 hour to daily reading. And that 1 hour should not be restricted just to reading. If you're too tired to read, if you open the books and you fall asleep, the best thing to do is watch videos related to anesthesia. So that is why we have the Conceptual Anesthesia app, where all the teachers are taking live lectures as well as there are recorded lectures. So if you feel like watching some topic, you can just simply plug in your earphones and watch the topic instead of going through the books. Second thing that you can do definitely is that if you feel like you're not in the mood to study, then look after your other things that you need to do during residency. What are the other things? Thesis is one of the most important things that we will speak about ahead. And another important thing that is very crucial is to have some kind of publications or conference attendance during your residency. All right. So make sure that you have 1 hour in your routine where you will be dedicating your time to some kind of academic work. Okay, then in first year, the third thing that I want you guys to keep in mind, which most of you all don't do, is remember you have a thesis that has to be done. Okay, most of you all have not done any kind of research in MBBS, so you don't know how difficult it is to actually go through the entire thesis process. Now, I always suggest this to my first year residents, that by the end of your first year, your thesis topic should be decided with your guide, and you should have made the protocol and submitted it for the ethics clearance. And if you want to be on the safe side, you should have got your ethics clearance by the end of first year. Okay, so when you join, you will know how tough your guide is, whether they are easy, whether they are tough, whether they will help you in your thesis or not. And if you feel like it is going to be a tough time ahead with regards to thesis, and your guide is very proper about what research you do, then make sure that you start this earlier, and make sure that by the end of first year, you definitely get your thesis approval, so that you can start collecting the data from second year onwards. Okay. Then the last thing that I want you guys to pay attention to is learn the basics. Okay, so I'm not telling you that start reading from Miller's Anesthesia from first year itself. No, it's practically impossible. You're not even going to understand anything. And moreover, you won't remember anything. It will be a waste of your time. Okay, so you need to learn the basics. You need to know at least what are the dosages of the drugs that you use every day. So if someone is asking you what is the dose of midas, what is the dose of fentanyl, what is the dose of propofol, you should know the dosages of these basic drugs. If someone asks you what are the airway equipment that you should keep ready in difficult airway case, you should know that you should be having your bougie, stillet, some kind of ventilating airway exchange catheter, your different types of laryngoscopes, video laryngoscope, fiber optic, all of that ready. Okay, so the basic things need to be clear. What are the basics in spinal also need to be cleared. So you should know that, so that they are confident in promoting you to second year. In which sense is that everyone from first year is going to go to second year. Okay, there is no test or exam that will say no, you have failed and you can't go ahead to second year. But in the minds of consultants and seniors, they will have this little bit of a differentiation, that this is a smart person and I don't need to overlook their year in second year, so I will give them more cutting, I will give them more skill enhancing techniques, I'll give them more responsibility to handle the cases on their own in second year, versus someone who likes to bunk work or doesn't do their work properly. So in that case, they will keep that person in a very time pass OT. Like, what do you mean by time pass OT? For example, if you have an option of having 5 orthopedic cases where there are chances of giving spinal in each one of them, versus having a plastic surgery case where from morning to evening for 12 hours you just have to sit because patient is under GA and only one intubation happens in the morning. So if there is someone who is hardworking, who has shown sincerity, who is definitely develop their skills well, that person will be put in the orthopedic OT. Someone who's ready to work fast and take the responsibility, that person will be put in the ortho OT, versus the other person will be put up in the plastic OT, because they are like, okay, we need someone dynamic in the OT where there is a frequent change in the cases. All right. So learn the basics and be sincere in your work. Now, this is about first year. I really want to tell you guys that in first year, there is no hard and fast rule that you need to be studying extremely hard from first year itself. No, it's just absolutely impossible in residency. You're going through a change in your complete lifestyle. So give yourself the first 3 months to understand your college, to understand your colleagues, to understand your consultants, to understand how anesthesia works, to understand how your institution works, okay, and to get used to the routine. So in first year, if you give yourself for your first 3 months to get used to the routine and you show that you are sincere, let me tell you, your next 3 years are very, very smooth. Another thing, the first image that you set as a first year resident, okay, where you're showing that you are sincere and you're ready to do all the work, and you also go back and you read up about things. You're not just not working at a spinal level, as we say it. You are actually putting in your efforts. That really creates an impression which lasts till your third year exams. So in your third year practical, suppose you make a mistake in saying something or you forget about something, your consultant, if they have liked your work in first, second, and third year, they will be more prone to helping you out during the exams, to giving you some hints, to giving you some ideas about answering in the exam. Okay, so those kind of things all depend on the image that you create in the first year itself. All right. So that's about first year. Let's see if anyone has any questions as yet. You guys can write it on the chat box. Yeah, I can see a few of you all saying hello. All right, so no questions over there. Then, as we enter the second year of anesthesia, this is somewhere where you'll actually enjoy this year. Okay, why? Because you already know what is the work that has to be done. You've been doing it for 365 days nearly now, and you've sort of become accustomed to it. I won't say you've become an expert at it, but you've become accustomed to it. So you are able to do things easily. Second and most important thing is that there will be a lot of responsibility that is put on you in the second year. Okay, so your consultants will be more comfortable leaving you guys alone in the OT, helping, allowing you to manage cases on your own and taking your own decisions. In first year, you have to ask your consultant on your senior before taking any kind of decision. But in second year, they give you more of a leeway ki chalo, you think, what do you think? What should you do? Should you give this drug to reduce the blood pressure or that drug? How much will you give? How much is the dose of spinal anesthesia do you want that you want to give for this patient? Okay, so those kind of decisions, they'll leave it up to you. And that really gives you that high that I have managed the case. So, second year is all about handling responsibility. If you show that you are a good, responsible anesthetist, you're sincere at your work, then in your third year, definitely you will be getting a lot of perks. All right. So, in second year, mainly the second year is divided into first half and second half. Now first half is generally the golden period. You get some time for yourself. You're not a first year resident, so you don't have to be running around like a zombie or doing emergency work all the time, or like listening to everyone. So you have some time for yourself. You leave the OT on time and you get some time for recreational purposes also. But as I would suggest, this is the time that you don't waste and you start studying. Okay, so in the first half of the second year, try to start studying at least the important topics. So there are a few books that I will be discussing in the following YouTube videos with y'all, and y'all can start off from easy books like Morgan Anesthesia. So what I had decided was in the first half of my second year, I had completed the entire Morgan and Michael clinical anesthesiology so that I understand anesthesia better, and whatever I felt I could write in the theory exams from that, I had marked it in the book. Okay. So important topics like cardiac anesthesia, pediatric anesthesia, regional anesthesia, I had already read from Morgan's in the first half of my second year. All right. And then I had slowly migrated to starting my studies from Miller's anesthesia. So even though you get some time to yourself, don't feel like, first year was very bad. Now I need 6 months of complete sannyas from the world and I'm going to just enjoy. Instead, use this time to study, to make notes. If you don't want to make notes, another thing that I used to do is I used to read a lot of articles. So about simple things like anaphylaxis in the OT or a difficult intubation. I used to read articles from journals like Indian Journal of Anesthesia and British Journal of Anesthesia, and I used to print it out. Okay. So I printed all these out, and then I collected it in a folder. And by the time I reached my third year towards the exams, I had all of these articles which were asked in the exam as questions. So I just revised through these articles. Okay. So you can spend your first half of your second year in doing all of this. You don't need to be reading to remember because that is towards your third year end. But you need to be reading to make sure you have the collection of what all you will be using as an exam source. Okay. Then, second thing is take responsibility. In second year, your consultants will want to give you responsibility, will want to leave the OT on you all. Trust me, there is nothing that a senior anesthesiologist wants more than getting out of the OT for some time. Okay, so that is something I'm saying from my personal experience. Even I don't like staying in the OT all the time. I would prefer if I get 5 minutes as a breather to go to the bathroom or 5 minutes to eat something, but you can leave the OT only if you have someone responsible behind you. All right. So make sure that you show that you're ready to step up to the responsibility. You're not like sleeping or dozing off in the OT, and you're not bothered. You're not watching the monitor. One thing that we commonly see is that people are all constantly on their mobile phones and they don't watch the monitor at all. So the seniors get very pissed off at that, and that creates a very bad impression. So remember, when you're in the OT, phone should be in the pocket and definitely not on the ringer. It should always be on vibrate. And remember, if there is any kind of emergency, you can always excuse yourself and go talk outside on the phone. But You have to show that you are going to be a responsible anesthetist once your senior or consultant steps out. Okay, so the more you try to take responsibility, the more in third year you will be given the chance to do difficult cases, the chance to do difficult blocks, the chance to do difficult intubations. And if you don't take responsibility, nobody is going to bother about giving you any of this, special cutting. All right. Then in second year, you can also start trying new things. So suppose there are any kind of novel things that are happening in your college. Like, for example, if someone is having a very different thesis, like, let's say if someone is doing breast surgeries under regional anesthesia, and you want to learn how it is done, how are the blocks given, or how is the epidural inserted, how do you give the drugs, all these kind of things you should read up about. There are always some consultants who want to try new things, so you should be the go-to person for them, that yes ma'am, I will read up about this new block, or I will read up about this new technique, or this is something that I have read up about, and let's try this in the OT. Okay, so all these kind of new things, because remember, while you're a resident, you have someone above you, so you can try doing all these techniques that you have never done before. But the minute you step out of your residency, all the responsibility comes on you as an anesthetist, and then you will probably want to just stick to the safe approach and not try anything new. Okay, and you are going to progress in life, you are going to get promoted in life only when you do new things, when you take the risk of giving anesthesia to patients that normal anesthetists wouldn't. So your growth in anesthesia depends on how you learn new things. And how will you learn these new things? When you do it under someone's supervision. And how do you do it under someone's supervision? You make sure that you read up about it and you tell others and you tell them that let's try this. Okay, now don't try with your colleagues during emergency, because all of them are on the same level. But I would suggest that you try it along with a senior consultant who knows that if something goes awry, how to take care of it. All right. Now, one of the most important things that I will give you from my personal um, anesthesia residency experiment, and that was that I made a really nice group in my second year of residency. Okay, so we were three of us, three girls, Dr. Pallavi and Dr. Susan and me, and we are still extremely good friends even 7 years after anesthesia residency is over. And we made this group primarily to discuss things with each other and study and share notes and stuff. And we ended up with a lasting friendship, of course, but we also ended up pushing each other to study on the times that we didn't want to study. So residency is something in which you're so tired and you're so like frustrated all the time, so you don't really want to study at all. But when you have at least one or two other people with you, around you, suppose someone's had a good day and they are sitting and studying in the hostel, you'll look at them and you'll be like, okay, Achal, tell me also a few things so that it goes into my head. Okay, so or you share your notes, or you share your knowledge, or you make up for each other in OT, like someone is not feeling well, so the other person can chip in the OT. So for all those kind of things, try to make a group of friends. Don't make a very large group, but don't make a very small group of just two people. Also try to make a group of friends of 3 or 4 people that are like-minded, and are not anti each other. They are not against each other, but they will actually grow with each other. Okay, so you make that kind of group for your, mainly for your academics, but also with your, to improve your personal and professional life. All right. Yes. So Anirudh is mentioning that, ma'am, please suggest books to read. First year resident here. So Anirudh, we are going to be having a separate session on that, where I will be discussing a lot of books that you guys can use in anesthesia. But just as a whole, I'll tell you some very few books that are mandatory, or rather very good to do. When I was in first year, I had read this Lee's Synopsis of Anesthesia. It's a very tiny book. So in my first 1 or 2 months, when I had no idea about anesthesia, I read about Lee's Synopsis. Then in my second year, first half of anesthesia, I read Morgan and Michael's Clinical Anesthesiology. That is slightly more, much more fatter as compared to Lee's, and it gives you more information, but in a very easy manner. And when I went to my third year, of course, from the second half of my second year and my third year, I read some topics from Miller's Anesthesia. I read some topics from articles, which you get online. You can just go on Google Scholar and find those articles. And then I also did read Stolting's Pharmacology. I read some practical books like Yao's practical case scenarios. All right. So whatever was all of this information, what I have done is that I had collected all this information over a period of 3 years, and then I ended up recording all the lectures for conceptual anesthesia based on this information. So that is how the app came into play, with literally the entire 3 years of my residency and the resources that I used. And then we um, actually put this into the video lecture form on the app. All right. So Pooja is saying, should we make notes in first year? Yes, of course, Pooja. If you're sitting in some OT, like suppose you're doing cardiac OT and you want to write down the steps of what are the steps before the patient goes on CP bypass, or after the patient comes out of CP bypass, or what are the drugs that are prepared, what are the things that you should keep ready. If you have a notebook or if you have an iPad which you can keep in the OT, you can always write it down, and you can use it when you're studying for your exams also, like practical knowledge integrated with theoretical knowledge. All right. So if you have the time to do that, you should. If you don't have the time to do that, you can also refer to ready-made notes. So on the app, whatever video lectures we have the app notes of that lecture also loaded in app only, so that the students can refer to the notes later after watching the lecture. Okay. Now moving on with the second part of second year. Now towards the end of second year, make sure that you have completed your thesis, your data collection is done, your statistics are done, your writing of the thesis part is done, and make sure that, towards the end of your second year or start of your third year, your consultant has approved your thesis, it has been signed and it has been sent. Okay, so this is the timeline for a thesis. Don't keep it till the end of third year, because that is going to give you a lot of stress, and you're going to end up spending all your study time on doing the thesis itself. Another important thing is that keep a logbook of the cases that you're doing. Generally, for all exams, DNB exam, MD exams, when you go in for your examination, Viva exams, you are expected to carry a logbook of the cases that you've done. So most of you all end up writing a logbook 10 days before the exam, but that is the time that you need to study and not to do all this. So even if you note down the cases on your phone, or you note down the cases on some log app, there are a lot of free logbook apps that you get. Or even if you note down the cases in a notebook every day, even if you note down one or two cases, you will have enough to write a logbook at the end of the year. Okay, and start writing this logbook towards the end of your second year itself, or in the beginning of your second year, so that you're not leaving this logbook preparation part till your third year. Okay. Then one more thing, because in second year you have time, I would highly suggest that you all try to publish at least one thing. It can be publication of a complete study, but by this time, most of you all have not completed your thesis. So the easiest thing to do is to publish a article. So how do you publish an article? You can write a case report, or you can write a review article along with the help of some senior consultant of yours if you've done something interesting, and you can submit it to a journal. So even if you have one or two publications at the end of your residency, when you go in for your practical exams, you can carry the printout of these things and show it to your examiner, and your examiner will be impressed. A. B, this will also help you later on in life to show that yes, you did have a research background when you did your MD or DNB. All right. So these are some of the things that you should take care of. Now, the third year, the main year, the final year, this is the time when everyone suddenly wakes up and remembers that, oh, I also have an exam to pass, and I also have to start studying for the exam. So what are you going to do in third year? Now, hopefully by your second year, you would have read at least a little bit about anesthesia. So in your third year, you should focus on first, whatever university exam you're giving, collect the past question papers. Then B, sort out the question papers into paper 1, paper 2, paper 3, paper 4. What I did was I wrote down all the questions that were asked in the last 10 years in paper 1, paper 2, paper 3, and paper 4. And then question by question, I went and I found the answer to them. And when I found the answers, I either wrote it somewhere, or I typed it out, or I took a screenshot, or most of the times what I did was whatever was the answer, I printed it out. Okay, and then I kept putting it in folders of paper 1, paper 2, paper 3, and paper 4. So this is what I did. I consolidated all the answers in one place. And I had a book where I used to write that this question answer is in this book, or answer is in this article, or answer is in this online web source. Okay. So then what happened is, when I went for my exam leave, I just had to revise the same source again. Don't keep changing your sources. You don't have so much time. Don't start off with one book and end with the other book at the end of the day, because that's not going to help you in passing your exams. You have to have the same constant source. So collect all your sources and keep in third year, especially from the questions asked in the past exams, and then you can revise it in the end. Okay. Third year is also the time when you're expected to attend conferences. I would highly suggest that you attend at least one conference in your entire tenure of 3 years. Okay. Attending conferences, you will know what are the new things in anesthesia, how do different institutions work, because most of the time we are just fixated to the kind of things that go on in our own institution. Okay. So yeah, I will answer your question, M. So I would suggest that go for one of the conferences. Now, someone wrote to me recently asking, ma'am, can you suggest any conference? So there is an Indian Society of Anesthesiologists called as ISA. If you go on the ISA website, you will find that ISA always has its annual conference, which is ISACon. So that is one of the biggest conferences in anesthesia. I would highly suggest that you go for it, because you're exposed to all different super specialties of anesthesia: obstetric, pediatric, regional, cardiac, difficult airway, all of this. All right. So go in for the ISACon conference, or you may see that even your state ISA. Okay. So your state part of your Indian Society of Anesthesiologists is organizing a conference. So if you don't want to travel too far out of your state, you can even go for your state conference. A few other conferences that are really useful are in Tata Hospital in Mumbai. We have two conferences. One is the difficult airway conference, all about the airway, and one is the ARC conference, anesthesia review course. And this is generally for third year residents who are planning to give the exam. So it's like a refresher course of all the exam related topics. One extremely good conference that I would highly suggest is the Ganga Anesthesia Refresher course, that is GARC, GARC. And this GARC conference is held in Ganga Hospital in Coimbatore. Okay, now we all know Ganga Hospital, Coimbatore is one of the apex institutions for regional anesthesia in our country. And in fact, I would say in the whole of Asia Pacific. I have also done my fellowship from there and learned a lot over there, especially from Dr. Bala Venkat, who was our ISA chief now. So make sure that you attend at least one of these major conferences. There is another major conference called as RACE, which is also exam oriented, which is at SRMC Chennai. So these are few of the conferences that you guys can attend. And make sure that you go at least for one, so that you can show, if someone asks you in your exam, especially in DNB, they want to know what you have done. So you can actually tell your examiner that, yes, I did attend this conference, and in this conference, I attended this lecture. So they will be slightly impressed. Okay. Now, another thing that I want all of you all to do in your third year is actively present cases. The problem is that most of us don't end up passing our practical exams. Why we don't? Theory we'll still be able to write, but practicals we don't pass because we are not used to speaking. We are not used to taking history. We are not used to doing examination. This was the thing that we hated in final year MBBS also, and it comes to haunt you before your exams also, when you are passing out your residency. So make sure that you present cases actively. Find some consultant and tell them that, no, ma'am, you please take one case presentation every week. If you're a batch of, say, 10 anesthesia residents in third year, put a rota for yourself that every week one person will be presenting a case, so that the person, you get used to your history taking, you get used to examination, you get used to being cross questioned. And when you go in for the final exam, you won't be extremely scared. If you don't practice this, trust me, in your final exam, you will just clamp up. You will not be able to say anything, even though you know things. And the minute you stop speaking, that is the time when your pass or fail is not sure. Okay. So that is the reason you need to practice, practice, practice. What I make the students do on the Conceptual Anesthesia app is I ask the subscribers to present cases to the faculty that we have on Conceptual Anesthesia. So even though it's online, We have a good case presentation, just like this on Zoom, where they present a dummy case to the examiner and the examiner cross questions them. So if you don't have anyone in your college who's willing to do that, or institution who's willing to do that, you can always message me on Telegram and I will put you in a case presentation with an examiner online. All right. So please do your case presentations. Don't go in straight for your practical exam with no practice in this whatsoever. Another thing that you need to do in third year is to start deciding how is your future in anesthesia going to be. Are you planning to immediately freelance once you get out of your residency, or are you planning to do super specialty? So do you have to start studying for super specialty exams, or do you want to just do a fellowship? For that, you need to have some background as to what are the fellowships, where are they available, how do you apply for them, or do you want to choose a different path? Do you want to go abroad? Do you want to go to UK, or do USMLE and go to the US, or go to UAE? So all of them have their own examinations that you need to be aware about, and you need to have enough time on your hand to figure these out, so that you don't waste time post your residency trying to figure out what you want to do in life. Last 3 months of third year is definitely going to be spent studying. As I told you, use your 2.5 years to consolidate all the information that is required for exams. Okay, I'm asking you to just consolidate, like how you made all the folders of PDFs in your laptop or iPad when you were preparing for NEET PG. And in the last 3 months, you have to revise from the same sources. So that is all about the do's in anesthesia residency, first, second, and third year. Now, what are the don'ts? I have put it together on this slide. As you can see, the first don't is don't argue with your colleagues all the time. Don't be a very, in very simple, childish words to say, don't be a fighter cock. So it's difficult to maintain your patience when you're so frustrated in long hours of residency. So I would highly suggest that fighting with your colleagues over call duties, or over who's getting cutting, getting to put the spinal, who's getting to put epidural, who's getting the blocks. All those, at the end of 3 years, most of you all have done almost equal amount of work. So there won't be any one person who will be getting a lot of cutting and the rest will be sitting around and not doing anything. ऐसा होता ही नहीं है. So try to work with your colleagues as compared to against your colleagues. Another thing is don't fight with your seniors. Okay. When I mean seniors, I mean second and third year residents, if you're in first year, and also consultants, especially consultants, because consultants are the ones who will take your side during your exam, who will help you out during your exam, who will help you out during the fag end of your residency when you have to give your thesis or submit your thesis. So don't cross lines, don't fight. If you feel like you are right, you still shut up and keep quiet and don't say anything. Okay, if there is any kind of situation in which you feel it's going to escalate to a fight or an argument, just take a deep breath, be calm, and don't say anything at all. Okay, that is the best thing to do in residency. Third thing, as you can see, this man smoking off. So don't get into bad habits. It's very easy to fall into a habit of alcoholism or smoking or drugs during residency, because you feel like I have to stay awake, or I'm too tired, I'm so frustrated, I need some high. But trust me, if you enjoy what you're doing, if you enjoy your residency, if you enjoy your branch, you're going to get the high out of working itself. Okay. I see a lot of people who turn from non-smokers to smoking like literally 2-3 packs a day by the end of residency. But remember that your health is the utmost important thing, not just during residency, but also the following years, because you're in your youth right now. So do not fall into bad habits whatsoever. And the last thing is, as much as possible, don't try to bunk work. Don't try to, like not pick up calls when there is an emergency case, or there's a message in the morning that I'm not feeling well, I'm not coming today. I see a lot of people doing that. They just, want to bunk and not turn up, because that sets a very bad example, and your colleagues will have to work more because you are not turning up at work, and your seniors are also not going to like that. So those are a few of the things that I would ask you not to do during residency. So that is everything that I wanted to share with you all. We will be having such more YouTube sessions also. So I would highly recommend you guys to subscribe to our channel and keep watching this. Now I'll just take a few questions. So someone is asking me, many residents start working outside too in second year. Do you recommend it, ma'am? No, it's not worth going outside and doing cases, because trust me, even if in one case, even in a case where there is standby and if something goes wrong and you're not able to save the patient, you do not have a degree to be working validly as an anesthesiologist, and that is going to put you into a criminal offense. Forget about paying up a lot of money to the patient and patient's relatives in court. So do please, without a degree, do not practice outside. Is it advisable to start preparing for FRCA during residency? Absolutely, it's advisable. If you have, I would ideally suggest that you start finding out the path for FRCA in first year itself. And then in second year, first half, that's generally a time where you have, some breather period. So you can start studying and give part one FRCA, at least the theory exam, which you can give in India also, I guess. I'm not very sure about that. So you can give that during your residency. Okay. How to plan for fellowship in case of bond posting in a state? Duration of fellowship. Okay, so forget about your duration of fellowship. First, you have to choose what fellowship you want to do. You want to do pediatric, you want to do cardiac, you want to do neuro. Look at the best centers for that fellowship and the center which is most feasible to you. Okay, now bond as much as possible. Try to finish your bond as soon as you finish your residency. And during your bond period, you can prepare for the entrance exam of that fellowship, and then make sure that your timing is such that you immediately finish your bond and join the fellowship. If the fellowship is coming somewhere in between the bond, then I would suggest that you first finish off your bond, wait for that much more time, 3-4 months, and then go for fellowship. I'll tell you why. Getting a bond post immediately after your residency is easy. You get a bond post of your choice in a place of your choice. Once you leave your bond midway and go, first of all, you may not want to come back and complete it, and then it will be on your head for a long period of time. And second of all, once you leave a desirable bond post, when you come back to do your remaining years of bond, you may not get it in a place of your choice. Okay, so getting that is also difficult. What about DNB exam after passing MD exam? Yes, so I have also done this. I gave my MD exam. I passed it in somewhere in July, August, and I made sure that I gave the next DNB exam that was in December. So this is DNB, which is for post-MD candidates. So you're fresh with your knowledge at that time. So whatever is the next DNB exam after you passing your MD, just give off the exam during that time. Can I start my practice after DA? Yes, Kichu. I know a lot of people who have done DA and they have started their practice, but I would suggest that because anesthesia is getting so competitive, because you have so many super specialties coming up in anesthesia, the least you could do is that after doing DA, you do your DNB from any institute is okay, but make sure that, on paper, you sound like a very good potential candidate for a job, if that is a plan. Otherwise, you can start freelancing. In freelancing, most of the times, no one is bothered about your degree. They are only bothered about how good you work and how available you are. All right, so let's see if any other questions we have. Yes, so those are all the questions. Thank you so much for joining me today, guys, and I shall see you on a similar session. Now, on the Conceptual Anesthesia app, I'm going to be taking the DNB OSCEs next week. So if any of y'all are interested, you can join me on the app for those. And this entire month on the Conceptual Anesthesia app, we are going to be having different specialties: neuro, pediatric, cardiac, regional, critical care, who are going to be taking the super specialty MCQs for the entrance examination. So thank you, and I shall see you next time. Bye, guys.